I think the thing that we've certainly learned today is that while none of you would have likely chosen to be in this room tonight or chosen this journey, there is a tremendous amount of hope and a lot of good news coming down very quickly for those who are on the kidney cancer journey in terms of treatment and new ideas and new ways of looking at the disease, and that quality of life is of utmost importance as we move forward with those treatments. So I hope that you've learned a lot tonight, and I hope that when you leave after we wrap our presentations today, that you go with a renewed sense of hope and talk to friends and your care staff, and reach out to us at Kidney Cancer Canada, because we really want to see ourselves as a partner on your journey. Certainly your medical team is of utmost importance, but let us be there to help you navigate some of the decisions and the processes that you need to go through as you move through this journey. So to wrap up, again, I'd like to thank both of the doctors, and I'd like to thank Mary for sharing your story. We do have a token of appreciation for you, and I'm just looking at the webcast, and we've got 25 participants online now. So between us, I think we've got about 50 people learning more about kidney cancer and connecting with one another. So that's a very encouraging sense of community we're creating. So I just wanted to share with you sort of what we as Kidney Cancer Canada can be doing for you. We've talked about the medical treatment, we've talked about some of the other issues that are there, what Kidney Cancer Canada has to offer in terms of our website, but our focus is really about improving the lives of Canadians living with kidney cancer. So that's the patients, the caregivers, and your family and friends. So how can we help you? Register with Kidney Cancer Canada. It's free. We will not bother you with all sorts of spam and lots of information. When we send you information, it's news that you need to know. It's about clinical trials. It's encouraging you to get accrual. Talk to your doctor about what clinical trials are out there. It's that treatment access that we talked about. So what's available, in what province, in what line, and how to get help and support so that you can get access to that treatment. Join the discussion forum and the interactive map. It's a great way to connect with others who are going through what you're going through as a caregiver or as a patient and a family member. You can connect with other people, ask questions, and be sure that you're getting the support that you need. Patient meetings like tonight are being webcast. We have them on our YouTube channel, so you can go through the website to that channel, watch all sorts of information with other experts, such as our doctors here tonight, talking about a variety of topics. And again, it's increasing your knowledge and empowering you as a patient or caregiver to move forward on this journey. And sign up to attend the free meetings like we had tonight, or consider attending our patient conference in Toronto. Again, that's provided complimentary to those who attend, and it's an opportunity again to be exposed to some of the best and brightest in kidney cancer treatment. Put yourself on the map. We talked earlier that again it's a way to connect. So all of those little dots across Canada are showing you people who've put themselves on the map to create our community in kidney cancer. And if we start to look into Ottawa, we don't have a lot of you on the map, and we were talking, or Dr. Bro was saying that it would be about 170 patients in Ottawa diagnosed this year. So we're clearly not creating enough community. So please, if you're not on the map, put yourself on the map. Ask your family members to get on the map and create that sense of community. So when a new patient is diagnosed in Ottawa and they click on that map, they feel like there's a team behind them. Join the discussion. Our discussion forum is active. We have patients, caregivers there. They're asking questions. They're sharing stories of hope and message of encouragement. I highly recommend it. A lot of people find it very helpful. You can go on when it suits you, in the middle of the night when you can't sleep, middle of the day when you've got a question and you just want to get it out there while you're thinking about it. Put it up there, and we have lots of active members who are there to respond. You can also take your conversations off to the side in a private conversation if you're not interested in sharing some of your more personal comments, and keep that just between you and somebody else. And I see a lady up here nodding considerably, so clearly the discussion forum has served a good purpose for you, so that's always good to hear from our point. Help us create awareness. Kidney Cancer Canada is a small organization. As we showed you, we're lean, but we're very focused. And in the 7 years that we've been in existence, we've been taking no prisoners and really moving forward. Our Director of Medical Relations, Deb Maskins, would say that we like to fight above our weight. So we create a very extensive list of all of the things we want to accomplish, and we set out very aggressively to do that. On behalf of patients. So you can help create awareness by following us, looking at our patient information on YouTube, following us on Facebook, or liking us on Facebook, and reposting our tweets, sharing that information. I know some of you here in the room do that with us. You can follow us on Twitter. We tweet and post links back to the website, talk about meetings that are happening. And again, that's a great way for us to be able to get our message out so more people know that we exist. And then we have the WordPress blog that we talked about earlier. Pay it forward. At some point, some of you say, what can I do? I'm through my treatment, I'm moving forward, or even if you're undergoing treatment, you want to do something, you want to give back. There are lots of ways that you can help us. There's your gift of time, and that's through volunteering, delivering information to the local hospital, dropping it off in a urologist office, posting on the discussion forum. That is volunteering your time. You're giving back to other people who are on this journey. Doing peer support. We have people who call and just want to reach out and talk to somebody, and we've got a group of peer support volunteers who are there to talk to others. We have working groups and communication, patient education meetings, organizing nights like this. If you're interested in volunteering, let us know. We do it all by teleconference. It doesn't matter where you are in the country, your input is important to us. If you have some talent or resource that you can provide to Kidney Cancer Canada, that's helpful. If you love to write, if you have a printing company, a website, creative materials, you like to tweet and would like to volunteer to help us get our messaging out, those are all ways that you can help us. And if you have a service that you can help with in terms of printing or resourcing, that's always beneficial to Kidney Cancer Canada as well. The other part of paying it forward is fundraising, and I call it the F word, but there are lots of ways to get involved in fundraising, and that doesn't have to come from your pocket. It can mean joining our Onward Research Circle, where you make a commitment of $275 a year for 3 years to support our research initiatives, but it can be as simple as creating a personal fundraising page where you ask people, instead of giving you a birthday gift or an anniversary gift, to make a donation on your behalf or in memory of somebody to support Kidney Cancer Canada's cause. And we have a great module that allows you to do that seamlessly and get in touch with your friends. We have a Kick It Up for Kidney Cancer event that we started last year. It was our first ever signature event. We raised $55,000 and exceeded our goal. We raised 110% of our goal, so we were very pleased as a first ever activity. We'd like other communities to start taking on that challenge as well. Create an event, whether it's a walk around a community pond, a community center, a run, a bike, something like that. If there's something that incites passion for you and you'd like to share and move the message forward in terms of creating awareness, every idea counts. So please let us know and get involved. So again, a great big thank you to all of you here tonight. There were some great questions. We certainly appreciate the gift of time from our experts tonight, as well as Mary in sharing her story. If there are no further questions, and I'm sorry, I'm seeing Deb again chiming in. For volunteers, we could use a lawyer. Hint, hint. So I'm looking at Mary, but trying not to too much. Anyways, thank you to those who joined us on the webcast. We're very pleased to have had all of you. And thank you to those in the room. There's still refreshments outside, so please feel free to stay around, introduce yourselves to one another. If you have any questions, feel free to ask me or Mona. And we're glad to help you out. So thank you again and have a safe drive home.